I'm often asked, how long does canaloplasty last? The answer I most often give, and the one that applies to all glaucoma surgeries, is I don't know. Over time, most glaucoma surgeries fail to maintain an adequately low intraocular pressure. Comparing failure rates among glaucoma surgeries, however, can be challenging. Why? Well, because not all studies share the same definition of failure. One of the definitions of failure used in the tube versus trabeculectomy study was an intraocular pressure greater than 17 millimeters of mercury or an intraocular pressure reduction of less than 20% on 2 consecutive measurements. Using these failure criteria, trabeculectomies fail at a rate of 10% per year, whereas glaucoma drainage devices fail at a rate of just over 5% per year. But many patients who undergo trabeculectomy or tube placement require an intraocular pressure reduction into the low teens. If failure is redefined to reflect this goal, then trabeculectomies fail at a rate of approximately 15% per year, whereas glaucoma drainage devices fail at a rate of approximately 10% per year. So how about canaloplasty? Well, the 3-year US study defined failure as an intraocular pressure greater than 18 millimeters of mercury, with or without drops, over 2 consecutive visits. This is a reasonable target intraocular pressure, considering that most patients who are offered canaloplasty have early to moderate glaucoma. Canaloplasty failure rates appear to be dependent upon whether cataract surgery, what's called phacoemulsification, was done at the time of canaloplasty. This is called phacocanaloplasty. Of those who had canaloplasty alone, the rate of failure was similar to that of trabeculectomy or glaucoma drainage devices. However, of those who had cataract surgery plus canaloplasty, phacocanaloplasty, the rate of failure was less than 10%, even 3 years out from surgery. That's a failure rate of only 3% per year. Canaloplasty is an improvement upon an older, non-penetrating surgery called viscocanalostomy. Conceived of by Dr. Robert Stegman over 2 decades ago, there is now data to suggest that the surgical procedure can last for over a decade. According to a recently published study, average intraocular pressure was amazingly stable over the first 10 years after surgery. Roughly 15.5 millimeters of mercury at 5 years and 15.5 millimeters of mercury at 10 years. By 15 years out from viscocanalostomy, there was a mild increase in intraocular pressure, just under 17 millimeters of mercury on average, though this was still quite an improvement from the average pre-surgery intraocular pressure of 42.6 millimeters of mercury. If viscocanalostomy can achieve such impressive long-term results, then it's quite reasonable to believe that canaloplasty, essentially viscocanaloplasty plus, would result in even greater long-term intraocular pressure reduction. Early comparisons of these glaucoma surgical procedures support such a belief. A published comparison of canaloplasty against viscocanalostomy noted that 18 months after surgery, the intraocular pressure averaged almost 2 millimeters of mercury lower in the eyes that had undergone canaloplasty compared to those that had undergone viscocanalostomy. So the question you're probably asking yourself is, will this glaucoma surgery, canaloplasty, work for me? And if so, for how long? That's the question those facing glaucoma surgery are really asking. Unfortunately, no one has the answer to that question. The best we can do is provide an estimate based on the available literature. For those with mild to moderate glaucoma with target intraocular pressures in the mid to upper teens, canaloplasty can be expected, on average, to achieve and maintain intraocular pressure lowering for years.